A 57-year-old woman presents with breathlessness. On further questioning, she also notes fatigue and lethargy. This has been going on for the last year. On examination, the GP notices a lemon tinge on her skin, as well as impaired vibration sense in her distal legs and feet. Given her presentation, what is the most likely diagnosis? Okay, let's look. She also notes fatigue and lethargy. She has breathlessness, fatigue, and lethargy going for the last year. So it's quite a chronic condition. Lemon tinge to her skin. This is not jaundice, is it? Impaired vibration sense. There's something wrong with her spinal cord, the dorsal columns of her spinal cord. What's the most likely diagnosis? So among the options, mostly anemia. Okay, iron deficiency anemia. Anemia can cause breathlessness, fatigue and lethargy as well, caused by anemia. What causes a lemon tinge? I'm not sure if iron deficiency causes a lemon tinge. I'm not sure how. Pernicious anemia. What is that again? Is it lack of vitamin B12? Why is it called pernicious again? Chronic alcoholism. Chronic alcoholism would cause one of these anemias. What causes pernicious anemia as well? Anemia of chronic disease and thalassemia. Okay, so I think pernicious anemia is lack of vitamin B12, if I'm not mistaken. And if you're lacking of vitamin B12, you also have neuropathy at the same time, which might explain the impaired vibration sense in her distal legs and feet. So I'm gonna go with pernicious anemia. Yes, the answer is pernicious anemia. A lemon tinge to the skin is associated with pernicious anemia. This question is asking about a patient presenting with dyspnea, fatigue, and lethargy. These are all symptoms of anemia. The patient's other features, as well as her age, lemon tinge to the skin, and loss of vibration sense in the feet, are most typical of pernicious anemia. The light yellow tinge is caused by the combination of pallor due to anemia and mild jaundice caused by the hemolysis. Okay. The loss of vibration sense occurs due to low B12 levels. They can also cause reflex loss or weakness. While chronic alcoholism can cause both the symptoms of jaundice and impaired vibration sense, it is less likely to account for breathlessness and is not the typical lemon color described in the question. So lemon tinged skin refers to anemia plus the pallor from anemia plus slight jaundice from hemolysis. Okay, so let's read a bit on pernicious anemia because I kind of forgot what it's all about. Pernicious anemia is an autoimmune disorder affecting the gastric mucosa that results in vitamin B12 deficiency. Okay, it is helpful to remember that pernicious anemia, pernicious means causing harm, especially in a gradual or subtle way. The symptoms and signs are often subtle and diagnosis is often delayed. While pernicious anemia is the most common cause of vitamin B12 deficiency, it is not the only cause. Other causes include atrophic gastritis, for example, secondary to H. pylori infection. What's atrophic gastritis? Lining of the stomach has been inflamed for several years. Wikipedia is better. Process of chronic inflammation of the gastric mucosa of the stomach leading to loss of gastric glandular cells. Okay. gastrectomy, if you remove the stomach, or malnutrition, alcoholism. Pathophysiology, antibodies to intrinsic factor, plus or minus gastric parietal cells. Intrinsic factor antibodies bind to intrinsic factor, blocking the vitamin B12 binding site. Gastric parietal cell antibodies reduce acid production and atrophic gastritis, reduce intrinsic factor production, reduce vitamin B12 absorption. So your stomach lining cells produce something known as an intrinsic factor, which aids in your vitamin B12 absorption in a certain part of the intestine. Is it the last part, terminal ileum? Vitamin B12 is important in both the production of blood cells and myelination of nerves, megaloblastic anemia, and neuropathy. Risk factors: more common in females, typically develops in middle to old age, associated with autoimmune disorders, thyroid disease, type 1DM, Addison's, rheumatoid, and vitiligo. More common if blood group A features, anemia features, lethargy, pallor, dyspnea, neurological features, peripheral neuropathy, pins and needles, numbness, typically symmetrical and affects the legs more than the arms, subacute combined degeneration of the spinal cord, progressive weakness, ataxia, and paresthesias that may progress to spasticity and paraplegia, neuropsychiatric features, memory loss, loss of poor concentration, confusion, depression, irritability. Other features: mild jaundice combined with pallor results in lemon tinge, glossitis, sore tongue. Investigation: full blood count, macrocytic anemia, macrocytosis may be present in about 30% of patients, hypersegmented polymorphs on blood film, low white cell count, and platelets may also be seen. Vitamin B12 and folate levels: a vitamin B12 level of more than 200, I'm not sure what this means, NH per liter. What is it? NH nano something, is it? Never mind. Is generally considered to be normal. Antibodies: anti-intrinsic factor antibodies, sensitivity is only 50%, but highly specific for pernicious anemia. Anti-gastric parietal cell antibodies, 90%, but low specificity, as often not useful clinically. Schilling test is no longer routinely done. Radio-labeled by B12 given on 2 occasions, firstly on its own, secondly with oral intrinsic factor. Urine B12 levels are then measured. Urine B12 means it was absorbed lah. Management: B12 replacement, usually given intramuscularly, neurological features, 3 injections per week for 2 weeks, followed by 3 monthly treatment of vitamin B12 injections. More frequent doses are given for patients with neurological features. There is some evidence that oral vitamin B12 may be effective for providing maintenance levels of vitamin B12, but it's not yet common practice. Folic acid supplementation may also be required. Complications other than the hematological and neurological features detailed above: increased risk of gastric cancer. Okay, Zero to Finals has some video. Let's have a look.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be going through Pernicious Anemia, and you can find written notes on this topic at ZeroToFinals.com/Pernicious Anemia, or in the hematology section of the Zero to Finals medicine. Pernicious anemia is a cause of vitamin B12 deficiency anemia. And B12 deficiency can be caused by either insufficient dietary intake of vitamin B12 or pernicious anemia. Let's start with the pathophysiology. The parietal cells in the stomach produce a protein called intrinsic factor. And intrinsic factor is essential for the absorption of vitamin B12 in the ileum. Pernicious anemia is an autoimmune condition where antibodies form against the parietal cells or intrinsic factor. A lack of intrinsic factor prevents the absorption of vitamin B12 and the patient becomes vitamin B12 deficient. Vitamin B12 deficiency can cause a number of neurological symptoms, and these are peripheral neuropathy with numbness or paresthesia, and paresthesia is like pins and needles, a loss of vibration sense or a loss of proprioception, visual changes, and then mood and cognitive changes. A quick Tom tip for your exams: remember testing for vitamin B12 deficiency and pernicious anemia in patients presenting with peripheral neuropathy, particularly with pins and needles. So there's 2 antibodies, and testing for autoantibodies is used to diagnose pernicious anemia. The first is intrinsic factor antibodies, which is the first-line investigation, and the second one is gastric parietal cell antibody, which can also be tested but tends to be less helpful. So what's the management? Well, dietary deficiency can be treated with oral replacement with cyanocobalamin unless the deficiency is severe. But in pernicious anemia, oral replacement is inadequate because the problem is absorption rather than intake. They can be treated with 1 milligram of intramuscular hydroxycobalamin 3 times weekly for 2 weeks, then every 3 months. And more intense regimes are used where there's neurological symptoms, for example, 1 milligram every other day until the symptoms improve. If there's also folate deficiency, it's important to treat the B12 deficiency first before you correct the folate deficiency. Treating patients with folic acid when they have a B12 deficiency can lead to subacute combined degeneration of the cord and quite significant neurological problems. Thank you for watching this video. If you like the
If there's B12 and folate deficiency, treat B12 first. And the 2 antibodies used for diagnosis is anti-intrinsic factor antibodies and anti-gastric parietal cell antibodies. Okay. That's all.